What if the real secret to surviving cancer wasn't just about fighting the tumor, but was actually hidden somewhere else, somewhere inside a patient's own muscles? Today, we're going to dive into a really cool pilot study that's using AI to read these hidden clues, and it might just change how we predict survival for good.
I mean, really think about that question. The whole idea here is that the standard scans patients are already getting for their treatment might hold a powerful, completely untapped source of information. Information that could totally shift how we approach cancer care.
All right, so to really get why this is such a potential game changer, we first have to understand the massive challenge that doctors are up against when they're treating head and neck cancer.
We're talking about a huge global health issue here. Head and neck cancer sees almost 890,000 new cases every single year around the world. It's actually the 7th most common cancer, and frankly, the survival rates, especially when it's caught late, really need to be better.
You see, for the longest time, doctors have focused mostly on the tumor itself. How big is it? Where is it located? But there's this growing feeling that that's only part of the story. A patient's overall physical strength, their resilience, that's just as crucial for getting through the tough treatments. But how on earth do you measure something like that? Well, it turns out the answer might have been hiding in plain sight this whole time, right inside a patient's own muscles.
The whole technique is called body composition analysis. And what's so clever about it is that it uses the routine CT scans that patients already have to get for their radiotherapy planning. That means no extra appointments, no extra radiation. The AI just zooms in on the neck muscles at a very specific point, the third cervical vertebra, or C3, and gets this amazing snapshot of the patient's total body health.
Now, looking at muscle on scans isn't a brand new idea. But the old way, it was painfully slow. A person had to sit there and manually draw lines around the muscles on every scan. It took forever, and the results could be different depending on who was doing it. But this new AI-assisted method, it's a total game changer. It's super fast, it's automated, and it's consistent every single time, which makes it something you can actually use in a busy clinic.
So let's talk about the star of the show here, the AI itself. You can almost think of it like a super-powered medical detective.
What they did in this pilot study was use the specialized AI software that was trained to automatically find and analyze those neck muscles on a CT scan. In literally seconds, it pulls out all this detailed data that would take a human expert a really long time to figure out by hand.
And the benefits here are just huge. It's using scans that already exist, so it's no extra hassle for the patient. And while a doctor, of course, double-checks the results, the AI gives them a measurement that's fast, objective, and completely repeatable. That's something that just wasn't possible before.
So you have all this incredible data being crunched by the AI. What happens next? Well, all of it gets boiled down into a single, really powerful new number. Let's break down how they do that. Okay, so the AI is basically looking for 3 key clues in the muscle. The first one is called SMI, which is just a fancy way of measuring how much muscle you have. The quantity. But then it gets even cooler. The other two, IMAT and HU, are all about muscle quality. They measure things like how much fat has snuck into the muscle tissue and how dense that muscle is. Basically, lower quality muscle has more fat and is less dense.
Then the researchers did something really smart. They used a statistical model to take those 3 factors, the muscle quantity and the 2 quality scores, and they blended them together into one single composite number. They named it the FUNC-RISK score. And the idea is simple. The higher the score, the higher the patient's risk. And this is where the story gets really compelling. Because this new score let the researchers divide all the patients in the study into 2 groups. And what they found, well, it created this incredibly clear tale of 2 very different patient journeys.
This was the real moment of truth, right? After all that work developing this sophisticated tool, the biggest question was still hanging in the air. Does this FUNC-RISK score actually connect to a patient's real-world chances of survival?
And the answer was a huge, resounding yes. Just look at this graph from the study. It tells the story perfectly. The blue line, that's the low-risk group. The red line is the high-risk group. You can see how the 2 lines just split apart, and they do it early and dramatically. As time goes on, the chance of survival for that high-risk group just drops off so much faster.
Let's put some really solid numbers on that. After 5 years, the survival rate for patients in that low-risk group was almost 72%, but for the high-risk group, it was just over 39%. That is a massive difference. And remember, this was figured out not by looking at the tumor, but by looking at the health of their neck muscles before treatment even started.
So what does this all mean for the future? Well, this is where it gets really, really exciting.
What could an innovation like this mean for how we actually care for cancer patients?
Just think about the possibilities. Doctors could use a score like this to spot the most vulnerable patients right from day one. If someone gets flagged as high risk, you could immediately bring in a nutritionist or a physical therapist to help them build up their strength before the tough treatments begin. It could also help doctors decide who needs to be monitored more closely. This isn't about replacing a doctor's judgment, it's about giving them an incredible new tool to work with.
Okay, now it's super important we pump the brakes just a little bit. These results are amazing, but they come from a single pilot study with 65 patients. So while the findings are incredibly exciting, the next big, critical step is to test this FUNC-RISK score in much larger studies with more patients from different hospitals to make sure it holds up.
You know, this study just opens up such a fascinating door, doesn't it? By using AI to unlock secrets that are already hidden inside our own bodies, we might be standing on the edge of a whole new era of medicine. One that's proactive, truly personalized, and where treatment isn't just about fighting the disease, but also about building up the patient.